Welcome to the Bowel Chronicles, where we dive deep into the world of bowel health. I'm your host Nikki Kilpatrick, and on this podcast we have raw and candid conversations with individuals facing various bowel conditions and illnesses. Through personal stories and shared experiences, we illuminate resilience and courage in the face of adversity. Be reminded that each story is personal and unique. These conversations are not to be taken as medical advice or to replace guidance from a doctor or healthcare provider. Our aim is to inspire and empower through these amazing stories, amplifying voices often unheard. So join us as we embark on this journey together. Sit back, listen, and be inspired. Enjoy the episode. Hey guys, welcome back to another episode of the Bowel Chronicles. I'm your host Nikki Kilpatrick, and today we are out and about on the move. I want you to come along with me to meet Jodie Ireland. Jodie is just 21 and she previously appeared on the Bowel Chronicles almost a year ago to this day. Jodie had undergone an ACE procedure as a 14-year-old, which is a little opening onto her abdomen that she inserted a catheter into in order for her bowel to work. She went through bowel and bladder failure at 14, and Jodie really needed urgent help last year. Jodie has gone through a hell of a lot in the last year, so I want to bring you along today. We're going to Jodie's house, we're going to interview her. You're going to get to see some of her new house that has been purpose-built for her. She was born with quadriplegic cerebral palsy. She's a full-time wheelchair user and she is an absolute legend. Let's catch up with Jodie and see what's been going on. So here we are guys with Jodie Ireland in her all new singing, dancing home, which is absolutely beautiful. I have shed a tear from I've come in here. I'm so emotional, overwhelmed, because I'm just blown away, Jodie, by the house being purpose built and adapted for all of your needs, and I just think it's absolutely incredible and it's well deserved. You've waited 5 long years for this moment, and you're settling in well. But let's go back, Jodie, to last year. You were last on the podcast in June, and between June and a little stay courtesy of the NHS, the end of October, beginning of November, bring us up to speed on what your health journey was like then.
So from last year, we were on the hunt to find a surgeon. So it was asking around, emailing. It's not what you know, it's definitely who you know. So we had gone through and looked at many doctors, and we found a doctor, and I was seen pretty quickly. My case was red flagged, which I'm extremely grateful for. And yeah, everything moved really quickly. I think I was seen in the September and had the surgery in the November, so that's quite quickly.
But you had been seen in September, but you had been left pretty much from, was it February? You were in the hospital last year, February 2024, where your ACE procedure was failing. It was leaking, and your basically feces, your bowel motion was leaking out onto the rest of your abdomen, and you had been left for months like that to just be at home. It was a long time. Yeah.
And I didn't know what my future was going to look like. I didn't even know what kind of stoma I was going to need. I was leaning on you, Nikki, and I was leaning on other doctors. They didn't know what stoma I was going to need. So even whenever I documented the whole journey on my socials from my bed with me being extremely poorly, and you'll see me go back and forward saying I need an ileostomy, I need a colostomy a few times because we're a bit lost. And I just never, at that stage, I never knew when I was going to see a doctor. If I was going to see a doctor, were they just going to fix my ACE procedure and then leave me to struggle for longer?
And sometimes there's a life expectancy put on the ACE procedure that was never really explained to you as a child or to your mum. And in fact, I think whenever your mum reached out last year on social media, and yourself, you were very, very lost. You were like, this is the scenario, we've been left, her ACE is failing, she's basically at home. I mean, you couldn't even be in this chair last year. You had to be lying down on your bed all of the time because it was leaking out onto your abdomen, and technically it was burning your abdomen, so it was. And one of the first things I had said was, your ACE looks like it needs adapted to become a stoma. You know, I've had several friends and have interviewed people where the ACE has failed and it's a stoma has been created, and I think even then you were like, is that an option? And I was like, you need to speak to a surgeon. And it goes back to this whole thing of advocating and pushing for yourself to not be left and just suck up your circumstances. And that was your case for, I think, 6 months, 7 months before you got anywhere.
Yeah, so you're right, it was 7 months, and we were extremely lost because whenever I took my medical power on from quite a young age, because I like to know what's happening with me. I like to be in charge as much as I can whenever medical decisions are being made. So whenever I signed on that dotted line to have that surgery, as far as me, my mum and friends and family knew, we were told that's a lifelong thing. So when it failed and this happened, we were completely shocked.
Yeah. So Jodie, let's go back then to September last year, whenever your appointment came up to go and see someone at the hospital. Who was that someone? You don't actually have to land a minute and give his name here, but was it a surgeon? Was it a consultant? Was it a paediatrician? Who was it?
Surgeon, and he's absolutely wonderful. Him, as well as my paediatric surgeon who did my initial ACE and suprapedic surgeries, are the only two doctors I can say with my whole heart have leveled with me as a human on both occasions, as a 14-year-old and a 21-year-old girl, as to what I want. And it wasn't just, I'm not just a body on a table for them. He was interested in, at that stage, my brand new house was still in development. I was hopefully wanting to return to uni. He immediately marked all those down. Even took interest in what I want to do, what my likes or interests, and I've never had anyone level with me. But
that's so important, because you just feel you don't want to be gaslit by anyone, and you know, they need to understand this is your everyday life, this is your quality of life, which had been completely taken away from you. You know, did he have a solution?
Well, that's what kind of blew me away, and I thought, right, maybe there's a bit of hope here, but I'm not a doctor, so by no means were we going in thinking. We were just meeting this doctor because, again, it's not what you know, it's who you know. So we were just taking a shot in the dark. We didn't know there was going to be a solution. We didn't know if it was just a case of close me up and do something. We had no idea. We're not doctors. So I, in my head, thought I'll come out and I'll be in the same situation.
Got nothing to lose really by going to that appointment.
I've got nothing to lose. I'm not a doctor. I don't know what can be done. There's already so many things that are unknown, especially in adult services, about the ACE. I was like, right, well, I've got nothing to lose and I don't know what I'm going in here for. And I'm already in such a crappy situation. It can't get any worse. So I had nothing to lose. So I went into that doctor's appointment and I was ready to fight. I've always had to advocate for myself, and even speaking here now about advocating for myself, and I think that's really important. But when it comes down to it, I will get nasty if it needs to be done. So I had that built up in my head so much because the last 7 months we've just been dismissed, and we don't know what that is, so it's not our problem, and you're too complicated, we can't deal with you. Those were all the answers that we were getting. And I went into the appointment and Mum sat down and I was ready to hear what he had to say and immediately bite back, because that's how it happens. Doctors say something, you bite back. It's instinctual at this point. It's been what I've been doing my entire life. And he looked at the computer, and as was said in the last episode, my medical history has always been the same. It's extensive. It's all there. All the laxatives, all the interventions that was trying to be made, even down to the fact that it was labelled behavioural at some point.
Yes.
Because they just didn't know what the issue was, and then going through all that when I was 14. So it was all there.
Yeah.
And he introduced himself, asked a bit about me, asked a bit about future plans, what I'm doing, stuff like that. Read through the medical history and said, so I can repair your ace. And I immediately was about to jump back and go, I'm not having my ace fixed just to sit for sessions for 2 hours, to go on the bath, to sit on the toilet for 2 hours every day to try to go. That was not in my, that was not a part of my game plan. As far as I was concerned, the ace was out the window. He says, I can repair your ace, and I was about to lean forward and say something, and then he went, but what do you want? That was when I was completely bowled over. Everything was, all my like exterior that I built up to fight everything, completely shattered. And this was the first time I was like, a doctor's actually listening, and he's giving me control. And I went, some sort of ostomy, because again, I was confused on what I might need, what type of ostomy it was. And he says, for you, I think a colostomy would be possible. Literally gets out a pen and paper and says, I will stitch up your ace site, close it, and we will. He already noted down that my left side was my more dominant side because of my cerebral palsy. Had that all worked out. We discussed all that, drew pen and paper, and was like, this is what it'll look like. Drew me a diagram and says, we can do that. I'll see you soon for your pre-op. I walked out them doors. I immediately started crying, and it was just pure relief. And even throughout going through surgery, which we'll get into, but every night he came, whether he was working or not, he came around and checked it on me, and every single night my gratitude was expressed. Very, very, very deeply, because I still don't think these doctors realize what they do changes lives, and he was just like, it's my job, but I was like, but no, you saved my life. So
you're like, I'm not just being another statistic or a tick in a box off your to-do list. This is life-changing, what you've actually done for me.
I was completely bowled over.
And
from the minute he said, I think a colostomy is your way forward, it was like I was the doctor. And he was just sitting listening to me, and I felt hope. And I think me and Mum we haven't got hearts of stone. We are emotional people, but you have to build up a tough exterior when you go through all that. Like, we couldn't even, Mum wasn't even up out of her seat before she started crying. I was grinning like a Cheshire cat. The second I got out them doors, I couldn't even speak, and it was tears rolling down my eyes. It was just a hope.
October, correct me if I'm wrong, I remember getting this ecstatic text message at the time to say, Nikki, I've got my update, it's happening on Monday, and I think that was maybe a Thursday or something. And as much as I was excited, I was disappointed because I was in hospital with pneumonia and I wanted to see you right before you could get your surgery. I was like, oh my goodness, it's happening on this day. I think it was happening around my daughter's birthday or something that stands out around the 3rd of November.
4th of November.
It was the 4th.
Surgery.
Yeah. So what did that feel like whenever you got told, like, this is happening, I'm getting colostomy surgery?
I'm the type of person that's just like, if something needs done, do it.
Mm-hmm.
It might make me sound psychotic, but I don't think about the risks. I only think about the rewards.
Yeah. Okay.
Because in my head, you can't get no worse than where I was at.
Mm-hmm.
Even though I don't have anything like colitis or, IBD or anything under that umbrella.
Yeah.
My life was just as dire as anybody else's, and I think
Exactly. Yeah.
that's something that I want to get across in my story, because there are a lot of us, even friends of mine are now going through it, whether it be their bowel or their bladder.
Mm-hmm.
So that's something that I want to get across while also respecting those that do have those conditions.
Yeah.
But I was buzzing. I was, let's get this done. I was itching, counting down the days like an absolute psycho, literally by the second.
Yeah. 3 more sleeps, 2 more sleeps, 1 more sleep.
I texted my friends and they're like, you do realise this is major abdominal surgery? I'm like, yeah, but I'm ready for it.
Mm-hmm.
There is a picture of me on my social media. My mum, we call her my cinematographer, because she takes all the pictures and videos and stuff for socials. And I'll never forget this. I was so excited, grinning like a Cheshire cat. The anaesthetist was ready and all the drugs behind me. Mum turns around and says, smile! I was already grinning, turned to her, took a picture, and she goes, I have never known anybody so excited for surgery, but I've always been that way.
Yeah.
Because again, I only see, it's not that I don't acknowledge the risks, I understand them completely, but whenever you're dependent on these things to live your life, you can only really focus on the positives.
Yeah.
And there was actually also like a student theatre nurse, and she walked in, she introduced herself, and I was that excited. I was literally giggling, laughing, like they were like ready to put me under. I was like, bring me in, let's get this show on the road. The wee student walked in, and I was grinning, so happy, not one bit anxious. Like, put me under, cut me open, do what you need to do. Because at that stage we didn't know whether it was going to be like full abdominal surgery or just the more minimal keyhole approach. And I actually had to say to her, like, this isn't normal. I'm a bit of a psycho when it comes to surgeries, but it's just I could only see
a better quality of life.
Better quality of life, and I was so ready for it.
Yeah. So when you woke up from surgery, obviously you had the pain of discomfort of surgery, and having cerebral palsy, that also means some spasms and how your body reacts to that. How did it feel?
Well, immediately when you said woke up from surgery, I turned to my mum and I cried, and I said, I can't believe it's done. I'm so happy. Mum, looking back at it now, Mum always said, that's the drugs, you just need to go to sleep. But I can stand by that and say that was my hand on heart, my emotion then, and still my emotion now. Because bags get such a bad rap, regardless of how you come into them. Some sort of, something under the IBD umbrella, cancers, they always get a bad rap, and people always say they're such a negative thing to live with, but this gave me my life back.
Yeah.
Recovering from surgery was difficult. But everything for me has that extra added difficulty because of my cerebral palsy. I have the most severe type of cerebral palsy, so and I have no control over spasms. I have no control over any muscles in my body. If they want to move, they do so involuntary, and I have no control, no warning, no nothing. So coughing and trying to clear your chest after surgery, that was so difficult. And granted, I did say in the clip before this, they didn't know how they were going to approach surgery, whether it was going to, because I have existing incisions from the original surgery when I was 14. So they didn't know whether they're going to need to go in through there, extend that, or go with the keyhole option. But I woke up and I immediately was like, show me everything. Whenever I was coherent enough to be like, I want to see everything. Because I like to know what's going on.
Yeah.
And I went, there's no scars. And Mum said there is. They just did keyhole. So if anything, it was just pain from, because they fill your body with air.
Yeah.
So it was the pressure from the air. And then also, no one tells you this, and you might have different opinions. I don't know whether it's like this for you, Nikki, but I find now I'm about 4 or 5 months out from surgery, and people say your stoma has no feeling, but I somewhat disagree. I think your stoma has a little bit of feeling, but yeah, it's not completely numb like everyone tells you.
Yeah, I think you're right, Jodie. I agree with you on this one. There is little nerve endings there.
Yeah, it's not completely numb like everyone tells you. Because my muscles are so active when something has been done. Even if I overexert myself doing an activity, I will get into bed and my entire body will spasm for 5 minutes just because I've put that extra bit of effort in. So imagine going through full abdominal surgery and then going off of what I've said about having no feeling in your stomach, kind of being a wee bit of a half truth. The nerves and stoma healing together caused my body to do some weird and wonderful things. I remember for a while after surgery, I don't know whether you got this, Nikki, because it's the first time I've actually spoken about it, so I don't know if I'm a unique case in this or whether this is someone else's experience too. But I found on the entire left side of where my colostomy is, on that entire left side of my stomach, you obviously get like the knitting together of the tissues and the like from all the like internal incisions, and I knew that was a thing. But like the sharp nerve pain, like almost like a wee nippy pain, and that would make my leg spasm. I remember one time my right leg, down my right side of my body is more affected than my left. So I can move my left foot somewhat. If you told me to lift it, I can maybe lift it a centimetre or two off the foot plate, but that's about it. My right leg can't move at all, complete dead weight. My stoma nurse was changing my bag one day, and she pushed down on my brand new fresh stoma, and I am kidding you not, my right leg, which was lying flat in the mattress, lifted from the bed like I was Karate Kid, and
Wow.
I went, oh, and she was like, oh, did I hurt you? And I was like, no, did you not just see what happened?
Yeah.
Like my leg and my arms and like, and as well as that, like the medications. So
Yeah.
I'm on a lot of medication anyway for my cerebral palsy, but the spasms, as I mentioned, were a wee bit insane. For doing weird and wonderful things, but also just breathing and just getting by.
Yeah, all of those nerve endings surely must be connected for that reaction for you to karate kick with your right leg.
It was the weirdest thing ever. For a second, I thought, "Oh, I'm cured," but no, I wasn't cured. It was
the only thing I
fluke.
kind of remember is the kind of the stitches knitting together would have been a bit like pins and needles maybe type thing, sharp around the stoma. It almost felt like it was bleeding, and I would have looked down to make sure it was okay. I was like, oh, that's a really, really weird sensation, and that did last, for a few weeks after surgery, and then subsided.
But imagine that happening throughout your entire body.
Yeah.
Literally from
off the Richter scale,
head to toe.
Yeah.
Even on my better side of my body, so to speak, my arms were doing weird and wonderful things. Because of the way things were healing and the way my stomach was feeling and the nerve endings, and even I actually used to just, whenever I was feeling better, obviously not in the early days because I was in that much pain, but like maybe a week post-op, I would just sit and I would literally poke different places on my stomach just to see what nerves were gonna work and what it would make my body do. But also with like the certain medications, as I said, I'm on a lot of medications for my cerebral palsy, and a lot of them had to be cut back for me to be on opiate pain meds because my cerebral palsy is that severe. As I said, the muscles will do what the muscles will do, and that's very hard to deal with while also recovering from major abdominal surgery. So I was doped up to the eyeballs. I was first on fentanyl. It wasn't even touching it because it was a clicker. It was a clicker, and obviously with me being visually impaired, they can remind me that it's there. They can tell me that it's green, but I am the only one that can push the button and administer the medication. So really, it wasn't suitable for me. Okay. But then we switched to Oromorph, which I just took orally. When I needed it. But I found also, even now, with all those kinds of medications, like I'm having tremors in my hands when I'm feeding myself, and I understand that medications and opiates and anesthetic and everything can take months to get out of your system. Yeah.
So you think it still has a knock-on effect on you even now?
Not so much now. I would say maybe in the first three months. But now that I'm kind of out of the 3-month bracket from having surgery, I'm a bit better. But for a while, like, I couldn't feed myself. I was throwing food all around me. My body was just doing weird and wonderful things, and that was hard to navigate, especially because they tell you to be so careful with your abdominal muscles after surgery. I'm like, I was having a spasm, and then I was thinking, is that going to cause damage? Or if I move like this, is it going to cause damage? So it was an extra layer of, not anxiety, but
it almost is like worry of, like, if I do this. Some people are worried about even sneezing or coughing because that can cause a hernia, or your spasms could do exactly the same.
I was on nebulizers because I don't have the strength to even do a proper cough. So
Mhm.
I was on nebulizers and everything. But because no one knows, everyone with cerebral palsy, like I said in the last episode, everyone with cerebral palsy is unique.
Mhm.
So even if I ask these questions to medical professionals, reality is they're not going to know.
Yeah, everyone is so different with cerebral palsy.
Yeah,
How it
so
impacts them.
I kind of just had to be like, and then
Exhibit A, as we call it.
yeah, we were in the middle of moving into this amazing house.
Mhm.
So usually my mum would stay with me, but I am a grown ass woman now, so I was like, go and deal with the house and just come to me when you can. So she maybe came up twice a day, and then other relatives would come up if she couldn't.
Yeah.
The,
But your hospital stay, even with cerebral palsy and your complex needs, your hospital stay wasn't too long.
no,
Yeah.
2 weeks.
Yeah.
But that was with the added complication.
Mhm.
When they closed up my ACE site, it's amazing now. You wouldn't even be able to tell that there was a tube there.
Yeah. It's incredible.
There's not even a scar because it was all done internally. I can only see it because I know how to spot scars.
Yeah.
But to the average person, you wouldn't even know that was there.
You had an ACE.
Yeah, and it's nice to kind of get rid of that and
Yeah.
have no. Not that I'm one for like caring about
Vanity or how you look.
but it was just nice to be like. It's not a reminder when I look down there of like what I had. Like it's not on my psyche in any way.
Yeah.
Like once it was gone, it was gone.
Yeah.
But unfortunately, when I was in theatre, it was explained to me. It just happens sometimes, and the way I look at things, with my look in life, I just take things with a pinch of salt and a bit of sense of humour, and I went, if it's going to happen to anybody, it will happen to me. So when they were closing up my ACE, and obviously that is your bowel, so there's risks of bugs and stuff, and unfortunately that happened to me, and I was feeling strain from the left side of my abdomen because I now have a part of an organ on the outside of my body, which was strange because it's just above my belly button, so it's not in the average place a stoma would be on your typical able-bodied person.
Yeah.
But because I'm in a wheelchair, it needs to be somewhere where I can feel it and know where it is because I'm visually impaired and be able to deal with it because I'll never be in a standing position. So it's just slightly above my belly button. So even rolling to get changed, I was then rolling on to my stoma, which felt really, really
weird.
strange.
Yeah.
But I got over that in like a few days. But then I started to feel like a really, really, really hot, like almost like pressure from this side of my abdomen.
Exactly where the ACE was?
And it was exactly where the ACE was. And it was actually on the first day of me getting up into my wheelchair. I got up, and just like you were saying a minute ago, Nikki, you immediately think any cough, any movement, anything at all, you've busted a stitch. Your brain automatically goes to, oh my god, what's happening? Like worst case scenario. So I got hoisted into my wheelchair in an upright position, which was okay, but for some reason this time I had a dressing over my old ACE site, over the old wound, and I just felt like what felt like a pop, and I immediately was like, what was that? Was examining all over me. And Mum pulled my t-shirt up just above my belly and looked at my oldest site, and we thought, oh my god, because what it looked like was blood.
Yeah.
But they hadn't closed it up completely, so they like stitched. What was explained to me is they stitch it up in like in almost like a wee circle, because they don't want to close it as a line, just in case there is any fluid in there that needs to come out. It can't escape. I then felt like acid was touching my stomach. It came back to the very beginning. Whenever my feces was burning my stomach, this was that times 10. And I was like, something's wrong. Someone go get a doctor, someone get a nurse. I don't know what's going on. And my mum was like, I don't know what's going on. Thankfully, we had a friend who actually works in the hospital, and she was on her lunch break, so she came up to visit us when this was happening, just as I was getting transferred. She witnessed the entire thing happening, and we were like, do you think this is infection? No, I don't think so. Got a swab taken of it, felt every touch of it felt like acid, and I have a really, really, really strong pain threshold, but they had to wash it out and clean it, and eventually it came back that it wasn't an infection. And again, just picked up the bug in the theatre, and if it was going to be anybody, it would be me. But it felt like acid, and it was back to it was almost like having flashbacks to where I was at the
where
beginning,
you were before surgery,
because they had to put a clear drainage bag on my stomach, and all I could see was all this fluid
coming
just pouring out of me. And I thought, what is going on? Had that on for a few days, and then the doctor felt round my incision and was just like, that's an infection. We're gonna keep an eye on, because at this stage I think I was maybe like 5, 6, 7 days out. So my stomach wall was nowhere near like closed. So that was her main concern. She was like, it's not closed yet. But we want to make sure that we clear this infection. But for me, it's always a double whammy, as I said in the episode before. If your bowel isn't behaving itself, even after it's been operated on, nor is your bladder. So my bladder was all up the lift. I was feeling not ill, but just like, what is going on? Just not at myself. Of course I wouldn't be feeling like myself. I just went through major surgery. But they put me on IV antibiotics 3 times a day. I have a really, 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 really strong antibiotic to cover both my bladder and whatever
what's happening with you.
Sort of, I still don't know to this day what kind of infection it was, because it never came back from the lab, even whenever we were being discharged. But we ended up on for like an extra week, just on infection control. I'm really hard to cannulate, so I can't tell you how many cannulas I had in replaced. I was a premature baby, so I have rubbish veins, so it would have only lasted like 2 days at the most, and then it would have pushed itself back out again, and then trying to find another vein was a nightmare. So trying to just get them IV antibiotics in me, and then after that they were like, your infection levels, we made sure that anything was running out of that wasn't anything. She said, the doctor said it should go from the like infection-y colour, which was like a browny reddy colour, to a yellowy colour, and then eventually run clear. So it followed that trend, thankfully, and then we knew we were going in the right direction. So they did a week's course of IV antibiotics. I started oral antibiotics when I was in the hospital, and then continued them for another 5 days when I was home.
And did you feel strong enough to be coming home, you know, post stoma surgery? If you were to like disregard the ACE, like
does anybody ever?
Yeah, it is difficult, isn't it?
I'm not gonna say I felt weak and not ready,
Yeah,
because I think after a certain period in hospital, everybody wants their own bed.
Had your colostomy started to work? Were you getting output into your stoma bag?
Yeah. After about 5 days.
That's when it kicked in.
Did
you find that weird, or like, because this is completely new to you, before you were having to insert the catheter into your ACE and be sat on the toilet for like 2 hours at a time, flushing the bowel, and here you didn't really have to do anything?
Well, considering how much of a dire, excuse the pun, shitty situation that we were in, I kind of already had that, because there was wind escaping from my ACE, but with your stoma, it's like times 1,000. Now, that's only for me personally, that's only in early days after surgery. Actually, she's quite quiet. I know. And you wouldn't even know I had a bag unless I told you.
Yeah.
But I am very upfront, and I like to like put bag covers and stuff on, and we'll get into that further on down. But I think after a certain time, everybody is just ready to go home. I felt comfortable enough. It was going. For me, that was massive. They weighed me after surgery, and I lost a stone.
Yeah.
And continued to lose weight. But we'd spoken to the dietitian, everybody involved, and we just came to the conclusion that was compaction for 10 years.
Yeah.
10 plus years.
In hospital, and I'm only going to assume it was a bit hectic when you got home from hospital, because it was only a matter of weeks then before you were prepping to move to this new house. But what was that like, you know, getting home and now having, was it a new routine of, okay, the nurses are coming in to see me, did they ever deal with your suprapubic catheter?
No, that was all mum.
It's always been your mum. So they would have previously been looking at your ACE, which was covered.
That was covered by my urologist also.
Yeah.
Because I had no one in adult services that was in colorectal up until this happened.
Yeah. So effectively you had been lying at home for months in your hospital bed with this ACE exposed, and it got to the stage then where you were having to put the stoma bag over your ACE to catch some of the contents. So it was almost like you were already living with a stoma bag. You got like a practice run.
Yeah.
And then it officially happened. But what was the difference whenever you got home?
Honestly, it wasn't that different. Because I already effectively, as you said, had a practice run. And in our communication, you know, just me and you have said, like, I'm prepared for this because I know what it's gonna feel like. For me, the main things was, how do we move my very, very, very floppy, unsupported body around correctly without hurting me, because I was still healing. And I couldn't even lie completely flat for about 6 weeks. I always had to be at some sort of angle because all I could feel, all it felt like was, and I don't know whether you felt this or if it's anybody else's experience, I felt as if I had like a big elastic band around my waist.
Yes, yeah.
And I felt like, oh, you're like, I always used to say, you're stretching the elastic band too far, because I could never be too flat.
Yeah, for me it was like all the pressure of the gas and air they pump in, and it was like, when is this ever going to leave my body?
Yeah.
And I remember being propped up for quite a while after surgery, and then eventually it was like removing one pillow at a time.
I would slowly, because I have a hospital bed and an air mattress, I would just slowly edge myself down, edge myself down, edge myself down. No, too far back up, edge yourself down, and just work at it. And then the other thing was just getting used to the fact that I had my organ on the outside of my body. Was I phased? No. But being visually impaired, and yes, I have help. I have wonderful carers that come in 4 times a day, and they're trained in stoma care, and it's quicker for them to do it because they can see what they're doing, and it takes them 5 minutes. But I was always determined to be as independent as possible. That's why we went through different bag systems.
Yes.
That's why we tried different techniques. So for even when I was in hospital, it would be, even if you don't have a full bag, just take your bag off. I found it easier using just wet wipes and then drying the area after, because dry wipes and water and blindness just don't mix.
That's fair enough.
So I had to play about with different techniques, and obviously different stoma nurses have different opinions, so I just had to kind of zone in on, right, this is what I can do. So even I would just take my bag off, I just put a wipe over my hand and just feel all and obviously through the first 12 weeks, if you are going for a stoma, or if you have a stoma, you'll know, or you'll be told that your stoma changes size, shape, so every couple of days I would just take a wipe and I would feel the grooves, I would feel the changes, and I actually says to my stoma nurse, even though I have quite functional sight, it's the way I explain it to people is like, if a camera lens won't focus, and then you maybe get half of a second of focus, and then it goes back to being blurry again. That's what my vision's like currently at this moment in time, but I won't ever be able to tell if it will change or get worse or get better. I just kind of have to go with the flow. So I told my stoma nurse, train me as if I can't see at all, so everything was done through touch. So it's just familiarizing myself with it, and then also getting to be like, it just became like a second belly button. A lot of people are, again, and this is why bags get such a bad
reputation, like name.
Yeah, bad name, because there was people on the ward beside me, or patients coming in and out who couldn't even bear to look at their stoma because there might have been a wee bit of blood, or they're not used to seeing a wee tiny bit of red intestine, and that's it. But I just was like, this tiny little round thing that is the size of my belly button gave me my life back, and it was like just having a moment to myself to learn all about that, but also just to be like, almost to have like a reflective moment, as funny as it is, like speak to it and say like, thank you, and thanks for doing what you do, even though it was surgically put there.
It's crazy, isn't it? Like, it's mind blowing. And we were just talking there, about how your aura changed, how your appearance changed. You know, people look at you and they say, you know, you look like you're in less pain these days. You know, it's working for you.
It's mind blowing
Yeah.
because up until this was life. I've known no other. I'm not saying I suffer day in day out. I hate saying the words I suffer with cerebral. No, I live with it. I have my hard days with it.
Yes.
It is shit sometimes. You really do struggle sometimes. But it's who I am. It's what I live with.
Yeah.
But for the first time to be told, even from family members, grandparents, aunties, uncles, cousins, literally everybody, when you don't look the same, you look different. And to me, that was completely alien. And I went, what do you mean? They went, you look pain-free.
Wow.
I honestly, I didn't even know what way. I knew what they meant because I was going to the toilet and I was physically seeing my body change. My stomach was flatter because I wasn't compacted. There was less pressure on my organs. There was less pressure on my bladder. There was room for everything. And it was bizarre to be semi-normal.
Yeah.
And to have like a new baseline all of a sudden, purely because I have a bit of organ on the outside of my body.
Yeah. Wow.
It's mind blowing.
Mind blowing and life changing.
I don't think I'll ever wrap my head around that, but I'm very happy with it.
Yeah. Jodie, so just to wrap up, let's talk about all the fun things. You know, we were just saying there, reflecting on the last year. This time last year, you were in a hospital bed in a dire way, and we just want to share with everyone the opportunities you've had now post surgery, especially. So, and even in the last 4 months we're moving into post surgery, how life has changed for you. You've moved into this amazing house.
So I've moved into this custom built amazing house. There are no barriers for me. I can do whatever I want, whenever I want. I can be part of the family. We can eat together as a family around the kitchen table. We can watch a movie together because there's enough room for me to sit in the house with them. Whereas before, I always felt like I was in the way.
The very door frames are wide enough for your chairs.
You could probably fit 2 chairs through the door frames. And that's another exciting thing because I have, like, my best friend is disabled. She's the same condition as me. And I was saying, like, I can't wait to actually have you over and to not be packed like sardines and to actually have a bit of freedom. But the house is a massive thing. It's the key to the rest of my freedom. I've been to a concert, so I went to see Sabrina Carpenter down in Dublin on the actual, and it was really like a moment for me because it was when I look back on my social media, knowing your like memories pop up. I was hospitalized on that day.
Yes.
And later on that day, a year later, I was sitting at Sabrina Carpenter down in Dublin with someone who I consider a little sister, and it was full circle. And then I went on my first holiday in 8 years. I'm gonna be real, because I like to keep it real. There was barriers, and it landed home that I'm not the same person I was 8 years ago.
Yeah. I'm
not as able as I was 8 years ago. But I had a newfound confidence. I was able to wear a bikini with a bag cover and have my body on show, scars and all, and not give a crap about what anybody else thinks, and absolutely love my body, and I'm actually gonna like speak up about this a lot more like on my platforms, because I'm only realizing now like the difference before and after is amazing. And there's more amazing things to come. There's more gigs, there's more things that I realize I can do. I've got a newfound confidence. I will show my bag to anybody that asks. Even when I had the surgery, and my friend who I consider a little sister, who I actually went to that concert with, was like, I'm interested, can I see what this is all about? And I literally changed my bag in front of her, and she was like, this is so cool, I can't believe this gives you so much freedom. So I'm less apprehensive, less self-conscious. I didn't even realize that I was self-conscious, or I was hiding who I could be, because all this was going on. But now, to put it quite frankly, and excuse the pun again, I don't give a crap. I'm just embracing everything that life has to throw at me. The last time we spoke, uni was on hold. And I got the phone call to go back to uni whenever I was only 8 weeks post-op. So I wasn't ready at the time. But right now, there's that much changing in my life, and there's that many opportunities for me to venture into and just experience for the first time in a new body, that I'm just taking things as they come, and I'm ready to embrace this new life, because I've never been in this body before. And I can say, for being nearly 5 months out now, it's I just want to keep going. It's absolutely amazing.
I love it. And Jodie, I'm welling up listening to you telling that, you know, because you've said you've never lived life in this body before, and you have this newfound confidence, and I think people in the bowel community will really resonate with that. But the power of your story, and you sharing it even with your friend, you know, showing her how you change your stoma bag and what exactly this does, is so important, you know, to continue raising the awareness. And you very much are educational on your social media platforms, and Jodie's handles will be shared in the show notes as always below, so do go over and give her a follow, please. And keep doing what you're doing. You're absolutely incredible. And you know, if we think back to not almost a year ago, just under a year ago, whenever we first, you know, came into communication and contact on social media, that was because I was sharing my own story. That was because I was sharing other people's stories. And when we connected, I had no idea how I would have an impact in your life. And I hope it's been a good one. We've had an awesome year of friendship, and that with your mum as well. But it's that in you sharing your story on your platforms, how that's impacting other people. You know, it's incredible that we actually get to do that. We get to spread awareness, and you've been doing an absolutely amazing job. So whatever the next 6 months brings, or year brings, you know, for you, take each day as it comes, and just tackle it like the legend you've always been. I have no doubt that you are going to inspire so many more people. So keep being you, Jodie. And thank you for sharing the rest of your story so far. We wish you all the best as you continue life with your colostomy and your SPC. So
thank you very much.
You're welcome, my dear. Well guys, I have a full heart after that. Jodie's new purpose-built bungalow is absolutely amazing. As I said at the start, it brought me to tears. and we just had an incredible time together today. So I hope you've had a wee look at those photographs. You've seen her in all her glory in her new chair, on her holiday there in her bikini, showing her stoma bag. What an absolute legend. Listen, it's over and out from us today. Do come back next week to join us for another episode, but until then, let's see you later.